Hello everyone, welcome back. I hope y'all are having a fantastic day today. I certainly am. Today I am going to teach y'all a little bit about myotonic dystrophy. In high school I took a class called rhetoric, and in 10th grade I gave a speech on myotonic dystrophy, and so I decided today I would film that speech and share with y'all. I might be looking down a lot because I have my notes from when I actually did the speech. So I'll try to look at y'all as much as I can, but I also will be looking at my notes because it has been a long time since I have even looked at this speech. So I hope y'all enjoy it and get to learn a little bit about myotonic dystrophy. Imagine a girl, 12 years old, being diagnosed with a fairly common abnormality called scoliosis. The doctor said it wasn't bad and that we would watch it. The doctor later put the girl in a brace for 2 years. In 2013, the girl started having an irregular heartbeat and chest pain, and the doctor just said that they would watch it because it wasn't anything severe. In 2014, the girl's grandmother fell ill from muscular dystrophy-related issues. At that time, the girl's parents started to ask the girl some questions. In March of 2014, the girl's parents took her to a neurologist for blood testing and an evaluation. In June of 2014, they found out she had myotonic dystrophy type 1. I am this girl. Myotonic dystrophy caused my scoliosis to worsen, which led to surgery. It caused my irregular heartbeat, which is no longer a problem. It is now causing lung disease and asthma, and occasionally makes me feel sick. The only problem is there is no cure, but there are medicines to help with my day-to-day symptoms. Right now, there is no way to free me from this disease. Myotonic dystrophy is a form of muscular dystrophy that affects many muscles and organs throughout the body. The Greek name is Dystrophia myotonica and is abbreviated as DM or MMD. The disease is also called Steinert disease after the Greek doctor who founded it in 1909. The name myotonic comes from myotonia, which means the inability to relax muscles. Myotonic dystrophy is a genetic disease. There's a 50% chance of it being passed down to each child. So if I have children, there's a 50% chance that each child I have could get it. If a person is found to have it, there's a 50% chance to pass it to children, then to grandchildren, and so on. For example, my grandmother passed it down to my dad, and my dad passed it down to me. My great-granddad showed symptoms, but the disease was not yet discovered. He never got tested for it. There is no known actual cause, but research is being done. What the doctors do know is that there is an expansion on a gene, and that gene is responsible for myotonic dystrophy. The enlarged gene is the cause for muscle and organ weakness. There are many symptoms, but the most common is in the hands. For example, if I were to put my hand in a tight fist, I would have trouble opening it until my muscles relaxed. A normal person will be able to immediately open their hand without any trouble. There are two types of myotonic dystrophy, type 1 and type 2. Type 1 affects the muscles away from the heart, like the hands and the feet. Type 2 affects the proximal muscles toward the center of the body, like the hips. There is a long list of symptoms. In the brain, There's problem solving, difficulty thinking, emotional and behavior problems, daytime sleepiness, nerve damage from hand and feet, from the brain. I often have to go to bed early at night because of the daytime sleepiness. In the vision, there are cataracts, damage to the retina and drooping eyelids. In the immune system, there are lower levels of antibodies in the bloodstream, so a person can get sick very easily. In the heart, there are rhythm problems, enlarged heart muscle, low blood pressure, even sudden death is possible. In the reproductive system, there's a high risk of miscarriage and problems throughout pregnancy and possible newborn complications. My mom had a very difficult pregnancy with me, and it could have been because of the myotonic dystrophy. In the bones, there are anomalies. In the skin, there's a risk of skin tumors. Melanoma is very common with myotonic dystrophy. In the respiratory system, there are breathing problems, especially in newborns, frequent lung infections, food and fluid trapped in airways, not able to breathe enough oxygen, and sleep apnea. In the muscles, there's weakness, trouble to relax, muscle wasting that worsens over time. Myotonic dystrophy type 1 has subcategories which are congenital and juvenile. And there is an earlier onset of symptoms in these, which is more severe. In congenital, they're usually life-threatening, and in juvenile, they're intellectual and learning disabilities. One other muscle that is affected from myotonic dystrophy is the tongue muscles, and so sometimes when talking, the tongue will tighten, and I will just have to stop talking until it relaxes. Progression varies for each person, but it is usually a slow process. Mine progressed faster because I had a big surgery which made my muscles weaker faster. In myotonic dystrophy type 1, it usually occurs in adolescence or early adulthood, and this is the type that I have. It starts in the distal muscles and works inward. In congenital, progression starts at birth with lung complications which usually improve. In teen years, they end up having a normal path of progression. Most people with congenital learn to walk. In juvenile, there are cognitive and behavior problems rather than physical. They follow the muscle patterns in their adolescence years. Myotonic dystrophy type 2 is very rare. It affects the proximal muscles, and mobility is the most thing affected. The weight-bearing muscles wear out quicker, which causes people to end up in a wheelchair if they have myotonic dystrophy type 2. It is especially rare unless you are from German descent. Myotonic dystrophy type 1 was first discovered in 1909 by a German Dr. Steinert. The myotonic dystrophy can be found in physical exams or lab testing. In a physical exam, the doctor will identify the pattern of muscle wasting. There are two kinds of lab testing. They can stick a needle into the muscle and observe the electric current in the muscle, or they can do a genetic blood sample, which is a definitive test. What they look for in the blood is alterations of the gene DMPK for type 1 or CMBP for type 2. That is the gene that keeps the muscles from functioning properly. There is no specific cure or treatment. Ankle or leg braces can help with walking. I sometimes have to wear an ankle brace on my right ankle. The doctors can do prescribed meds to help alleviate symptoms. That is what my doctor has had to do for me. Heart and eye problems can be treated as well. So in research, they are currently working on trying to solve the burden of this disease. They're working to find a cure and eliminate symptoms of daily life. They use common myotonic dystrophy symptoms to find medications to help to alleviate the specific symptoms. To find a cure, researchers need to find a way to stop the gene from enlarging. We can all agree that this is a very complicated disease that affects many muscles and organs. Most would agree that all diseases need cures. It is obvious to most that awareness of diseases like breast cancer raise funding, so shouldn't myotonic dystrophy be well known? If it was more well known, would there be more funding? If it was more well known, would there be more research? If it were more well known, would there be more treatment or even a cure? To all of these, I say yes. Myotonic dystrophy should be more well known so that it can receive more funding, research, and treatments towards a cure. If more people knew about myotonic dystrophy, it would generate more funding. It is not something that is well known, and if it's not known, people don't donate to it because they don't know about it. It isn't well known even across the globe. Some doctors that are researching have never even heard of the doctor until they started researching it, which was very alarming to me. People did not know I had myotonic dystrophy until I did the muscle walk. Most of the people have probably never even heard of myotonic dystrophy. They may have heard of muscular dystrophy, but not myotonic dystrophy. When they were made known of my disease, they funded it, and I was able to raise a total of $5,551 my first year of muscle walk. Michael Goldberg started a fund for myotonic dystrophy research. $1.25 million was donated to Rochester Med School for myotonic dystrophy research. When people know about the walk, they donate. When they know research needs to be done, they donate. If more people know about myotonic dystrophy, it would lead to more research. If there is more funding, there can be more research. There are private and federal donations. The federal donates through the National Institute of Health. They give $9 million out of $32 billion to myotonic dystrophy. Surprisingly, they help with myotonic dystrophy. It is not much, but they do contribute to the funding. There are also private donations which play a bigger role. In the private donations, there is room to take a greater risk in life-saving cures. If a person donates, they could personally save a life. A third final reason that myotonic dystrophy should be more well known is if more people knew about it, it could lead to further treatment options and maybe even a cure. Since 2001, there have been 67 clinical trials and there are currently 37 underway. They are making progress towards a cure. 35,000 myotonic dystrophy patients in the U.S. are waiting for a cure. At Baylor, they are studying the defects of muscles. A doctor in Virginia found a therapeutic which could slow progression of muscle damage and dysfunction. A cure will most likely be to keep the expanded DNA from growing. There's nothing definitive yet, but progress is happening. So people need to know about myotonic dystrophy because it could generate more funding, lead to more research, and could lead to further treatment options and maybe even a cure. Now, some people may not agree with me. Some people might say not many people have myotonic dystrophy, so why should we know about it? According to rarediseases.org, 35,000 people in the U.S. have myotonic dystrophy. And that's not the whole world, that's just in the United States. The undiagnosed number, people who have it but haven't been diagnosed, is unclear. 1 in 100,000 people in Japan have myotonic dystrophy. 1 in 10,000 people in Iceland have myotonic dystrophy. This is a hereditary disease. It will not just go away. It potentially will continue to be passed on. The more that is known about myotonic dystrophy, the undiagnosed people can be discovered, treated, and hopefully cured. It is imperative that people know about this disease. Another person might say, other things need more funding because they are a bigger threat. For example, cancer. More die from cancer than of myotonic dystrophy. So people would probably say cancer needs more funding. Those with myotonic dystrophy suffer from multiple things, and it is because it is a very complicated disease, and some, like my grandmother, do die. Death is not a resolution for all. A cure is needed so no one dies from myotonic dystrophy. Funding will help find a cure and give knowledge to those who don't know about myotonic dystrophy. Lastly, one might say, if people aren't dying from myotonic dystrophy, does there really need to be a cure? Yes! According to Oxford Journal, most myotonic dystrophy patients die in their 50s or 60s, but can be at any age. My grandmother died at about 70 years old. The National Institute of Health said myotonic dystrophy patients have a higher risk of cancer. Those specific cancers are thyroid, melanoma, testicular, and prostate cancer. According to Medscape, myotonic dystrophy patients are at high risk for heart arrhythmias and sudden death if not treated. Clearly, people across the world are dying of myotonic dystrophy. There is not only a need for a cure, but people need to know about this disease. It is unfitting to say there is no need for a cure when people are dying. In conclusion, myotonic dystrophy should be more well known across the world. If it is more well known, there can be more funding, and if it is known, there can be more research and a cure. If there is a cure, I and so many others would be free from the burden of myotonic dystrophy. It would be a joy to be able to shake a person's hand and immediately let go, to be able to talk without any trouble. People are suffering, and others clearly need to know about this. Thank you. So that was a speech that I gave in 10th grade. And I do think it did help people understand a little bit more what I am going through and what I can go through. All of those symptoms are possible. I do not have all of them, but I do have some of them, as y'all probably remember from the videos on my story. So I just wanted to share this with y'all to educate y'all so that y'all could learn a little bit more about myotonic dystrophy and maybe understand a little bit more. I will again leave the links to myotonic dystrophy down below. There's one on myotonicdystrophy.org and mda.org, but I'll link those below. Please comment, because commenting helps with YouTube's algorithm so that my videos get out to more people, and especially with this video. I would love it if more people could see it so that more people can be educated, so that hopefully there can be more funding for a research and hopefully a cure one day. And if you liked it, please be sure to give it a thumbs up. If you are not subscribed to my channel, please hit that red subscribe button below this video and hit the notification bell next to it so that you get notified whenever I post new videos. I will see y'all next time. Hope you have a great rest of your day. Bye, guys. Hi. While editing, I realized I left out a piece of encouragement. So today's piece of encouragement is Joshua 1:9, which says, "Have I not commanded you? Be strong and courageous. Do not be afraid. Do not be discouraged, for the Lord your God will be with you wherever you go.